Listening to podcast is no replace. Listening to podcast is no replacement for real training. While we attempt to provide accurate commentary, we hold no responsibility on how you use the information we provide. Get medical training. In the blink of an eye, everyday order can be replaced with once-in-a-lifetime chaos. Be prepared. This is the Civilian Medical Podcast.
Awesome, guys. So welcome to another episode of Civilian Medical Podcast. This is episode 17. My name is Dietrich. I am Skinny Medic on YouTube. I got my good friend here, Sean, who's the Howard Stern of podcast.
Well, I think Howard Stern is the Howard Stern of podcasts.
True, touche.
I might be one of the Howard Sterns of gun podcasts, though.
But you can behave too. Like I was thinking about that. Like you can behave. Like you have the Howard Stern show, then you have our show, and you're pretty calm.
I'm totally normal-ish.
What medications you take?
Zoloft.
Okay.
No, that's that is high praise because Howard Stern's pretty awesome. Although I don't know that I could ever compete with that hair, man.
Yeah, he does have better hair than you.
He does. I mean, let's be honest, everyone has better hair than me.
So this episode, we're going to kind of talk about pressure bandages. And I think like this is like the redheaded stepchild of the trauma world, that and chest seals. Like they kind of go there because everybody wants to talk about tourniquets, and including me. Like I love talking about tourniquets. But, pressure bandages is kind of like, oh, well, I'll just throw something in there. So kind of want to talk about, what they're used for, some ideas that if you want to use a commercial pressure bandage, or you want to improvise, or you want to go cheap, or you want to go expensive. We'll kind of run the gamut this episode.
All right. Yeah. And there's so many options. This is definitely one that I always hear a lot of questions about because people are just like, 4-inch, 6-inch, how long do I need? Which one have the best? Yeah. So this, I think this is a great topic.
The 4 to 6 inches joke is just too easy.
Okay, so who's the Howard Stern?
Yeah, I just started giggling like a little girl when you said 4 to 6 depends on what you need. I'm like, well,
I love it. Where do you want to start here?
So I kind of just wanted to talk about why we might be using a pressure bandage instead of a tourniquet in some areas, stuff like that. So kind of I mentioned this. I just recently did a pressure bandage video on my YouTube channel, and I talked about that pressure bandages are used to what they're there for, to hold pressure. We're not wanting to absorb the blood like we think about. We're wound packing so we can get pressure down the artery, pressure down where the bleeding's coming from. And so this pressure bandage we're going to put on is going to help continue that process to control the bleeding. And, we can use it on an arm or a leg, but there's plenty of other uses we can use a pressure bandage too.
Yeah, 100%. What are some of the uses?
So, I like using on junctional areas, maybe like where we have wound patch, in the shoulder, the pelvis, where you just can't get a tourniquet up high enough that you have wound pack, whether you use combat gauze, C-locks, or regular compressed gauze or whatever. Now you've got the bleeding controlled. Now you just want to hold everything in place. So you can use a pressure bandage for that. No problem there. Wrap it around and secure it. Then, head injuries. Scalps bleed a lot, and they're very vascular. So someone can get a little minor cut on top of the head and the hairline, something like that, and you think that they're going to bleed to death. But really all they need is a good pressure bandage, things like that. So you could use most of them come with some kind of absorbent pad on there, or you could use a 5x9 to create your own pressure, get the bleeding controlled, and then wrap it around. Another thing too is people don't think about is like holding a splint. Maybe say you've used a SAM splint to splint an ankle or a wrist, and now you need something to hold that splint together. So the bandages are nice and wide. We already talked about that 4 to 6, even 8 inches now. You can get a wide bandage. You can wrap it up, hold it in place. And then abdominal injuries. Heaven forbid somebody get like an evisceration where like intestines are hanging out, or a big nasty abdominal injury. You can use a pressure bandage to go around that and kind of hold some things in place.
Yeah, 100%. Now I do want to talk just quickly about methods. Head, pretty reasonable, right? You just kind of wrap it around and do it like that. But let's talk about junctional. What is your technique for using pressure bandages to hold pressure on junctional areas, the axilla, the groin, all those different places?
So for me, like if I'm gonna wrap a shoulder or pelvis, I try to stay on that side of the injury that I'm going on. So like if I've got something on the right leg, I'm gonna push my pad down where I need it to, and then just run it down the right leg and kind of come at an angle. You know, and especially with the chest area too, you have to be careful. It's kind of the same technique. I'll go up under the armpit and wrap it around to kind of go that way because you don't really want to go across the chest, especially when you're pulling these things pretty tight. You know, you don't want to make it so the patient can't breathe so well. So going across the chest area, straight across can be a problem. And then if for me, like if I'm using a neck, then I will put the pad down where the neck injury is, and then I will come across the chest up under the armpit. If you get the patient to raise their arm up in the air and you run the bandage like diagonally across, then when they pull their arm back down, it actually pulls a lot more pressure tight on that neck injury. So I like doing it that way. I just try to avoid going diagonally across the chest. That way I don't prevent the patient from taking a full deep breath. And then another thing to think about too is when you're doing arms and legs, make sure you're checking for pulse motor sensory afterwards. Because these bands are that 4 to 6 inches, you can very easily make a tourniquet with these things because you get that such wide pressure. So when you do apply it, make sure afterwards you double check they've got a pulse. They can wiggle their fingers or toes and they can feel you touch. And that way you're not creating a tourniquet. If you have created a tourniquet, then I'd probably release it just a little bit to get blood flow back in there. So you just have a pressure bandage.
Yeah. And since we have no mechanical advantage there, my big worry there is that we create a tourniquet, but then we don't fully close it off. So we end up with like compartment syndrome or something else like that.
Exactly.
All right. What about my pants? Can I use those as a pressure bandage?
You know, I've seen some stuff where guys have used them, they cut up, make them like the 70s bell bottoms pants, and they start tying them and stuff like that. So there's some ways to do some improvised tourniquets. You know, we've seen like the old school, like bandanas, people using their shirts and stuff like that. You can improvise and make an improvised pressure bandage. You know, any kind of cloth that you can make nice and wide. I would say make it several inches wide and start, trying to use a pressure bandage out of it. You can get a mechanical advantage, but then you're going to start worrying about tourniquets and stuff like that.
Yeah. And definitely, I think stretch is a pretty good thing. So I would definitely defer to a more commercial product than my shirt or something like that.
Yeah, like I agree. Like for me, like I'm going to use a pressure bandage. That would be my plan A. Kind of the same thing like when we talked about tourniquets before. My plan A is to use a good commercial tourniquet, but I always need a backup plan. So I would encourage you guys to do the same thing. Make a plan A, B, to have good quality medical supplies. And then plan B is I start improvising stuff.
Yeah, 100%. So 4, 6, 8 inches, all that good stuff. I mean, 2 inches, depending on how you roll. But
depending on how you're going to, it's not the size, it's how you use it. That's what I understand.
Well, I mean, that's what I say, but.
So yeah, I mean, there are different sizes depending on, and I basically ask people when they start asking about the sizes, what pouch you're using or what's your idea you're going to use this thing. If you've got plenty of room, then a 6-inch. If you're using a micro rig or compact pouch, then maybe looking at going in a 4-inch. They also have them in 4-inch flats or 4-inch round. Like our ankle kits we carry, we have a 4-inch flat on there, which is perfectly fine. If my full trauma kit, I have a 6-inch Israeli in there. And then, my backpack kit, I have an 8-inch just because I have more room. I can carry a bit larger supplies.
Yeah, absolutely. Makes sense. So you basically, the largest that you can carry is the one you're more interested in, pretty much, that you can carry comfortably in whatever method you're using.
Exactly. I mean, like we talk about our ankle kits. Ankle kits are already kind of difficult to conceal. They're doable, but they can be kind of difficult to conceal. So I wouldn't run a 6-inch Israeli on my ankle. But a 4-inch flat or 4-inch mini, absolutely, that fits perfectly there. But in my backpack, I've got plenty of room. I keep a lot more supplies in there, but I still got plenty of room, so I don't have to carry the 4-inch mini in there. I can step up, carry a 6-inch Elias or something like that in my backpack kit.
Yeah, 100%. What about just like the old stalwarts, the Ace bandage?
Yeah, I mean, I see a lot of this going on. People, I would say that was definitely a budget item, using Ace bandage, because that's when I do a video or you see an Israeli, it's like, oh, that's just a Ace bandage with an ABD pad or 5x9 on there. And I'm like, they're kind of right. I mean, they're not far off, but I think if you're on a budget, I think you can go Walgreens or wherever first aid supplies place and buy some Ace bandages. Even the Coband, like when you give blood, that stretchy material that they put on your arm after you give blood, it kind of sticks to itself. That could be used as a pressure bandage. And I tell people, don't go to Walmart or CVS and buy that kind of stuff. It gets super expensive. We actually buy some of our stuff at like Tractor Supply. You go to buy the horse tack.
Yeah.
I don't know what they use it on horses. I'm not a horse expert, but that stuff is a lot cheaper than buying just the regular Coband off of the first aid aisle.
Yeah, I love that stuff, by the way. I keep it in all my kits.
Yeah, the only thing I would encourage you to look at is when you're buying it, make sure you're buying latex free. It shouldn't be a huge issues, but you just make sure, because sometimes I pick stuff up before and he's like, oh, that has latex in it. And so people with latex allergies can be sensitive to us. Just be careful about that.
Yeah, actually, excellent point there. So those are pretty great, but now we get into the actual just the chaos that is this space, because there's so many. Where do you want to start here?
Man, there are so many. Like I kind of like listed the ones I could think of. I went on Google, just kind of just double checking, and man, they're like every company has their own pressure bandage, and like they all are different. So I think the Israeli bandage, the emergency bandage, is probably the most popular on the market.
Yeah. And who makes that? And is it a style? Is it a manufacturer?
It's a manufacturer. As PSY Medical makes it, and that's probably the most one. That's, like I said, I think that's the most popular one. Everyone has seen it. You've seen them at gun shows, things like that. So I think a lot of people carry that one, and it is a gray bandage. That's either come in 4, 6 inches, or even 8. I think they may have a 12, to be honest with you, if I remember correctly. But they're huge. They have absorbent pad on them. Like the T3 bandage is made by same emergency bandage, same company. It has wound packing gauze with it. It has a 5-button or abdominal pad that opens up, so it kind of gets larger. So that's a cool bandage. That T3 is very small, compact, and has a lot to do with it. And then it has a pressure plate on it. So what you can do is you put your absorbent pad over the wound, run the bandage around, and when you get to your pressure plate, you can run it through and then come back on top of itself to kind of generate some more force on top of the wound.
Yeah, and then so what is that bar called? That claw bar?
Yeah, I just call it a pressure plate. I'm sure it probably has a more technical, fancy name than that.
Yeah, I always try, and then when you pull that back, I try to put that plate that sits at the bottom of that directly over the point of injury. And then
yes, because
really,
you're like trying to put you would think about in your mind, like you want your finger on top of that wound.
Yep.
So if you can put that plate where your fingers would be, I think that helps out a lot.
And then you can wrap, twist to get even more pressure if you need it. And yeah, these are.
Yeah, I still end up putting a twist in mine. Like when you're coming around, like you're trying to keep it nice and pretty and wide, and then right on top of the wound, I will take and twist the bandage to have it as put more pinpoint pressure on there.
Yep, absolutely. Allows you to get a lot more of that downward pressure directly to point of injury, which I think is pretty great. What do these generally cost?
They're about $10, $15, $12, something like that range. Now you can go to the gun show and buy them cheap because they've expired or their vacuum seal has opened up. So I know a lot of guys who pick them up at gun shows and things like that, which absolutely there's nothing wrong with that. They do have an expiration date on them, but that's because of the sterility. They want to keep them sterile. So what we're using them for, I'm not necessarily worried about being sterile. Like I want it to be clean, but I don't want to be sterile.
Yeah, absolutely. All right, so that's that one. What's next?
So I just want to touch on that one quick thing about being sterile and clean. Like sterile means like we can do surgery with it and stuff like that.
Right.
And then clean means it's not dirty. So what we're doing is we want it to be clean, and we can give some antibiotics, things like that later if we need to when they get to the hospital. But we can keep things clean. One thing with this Israeli bandage here too is I always take mine out of the packaging because there's 2 packs in there. Like when you open up the first pack that has the directions and things like that, there's another packaging that's clear that's vacuum sealed too. So When I put mine in my kit, I open up the first packaging. It's still vacuum sealed, but now I only have to open up one thing to actually get to my bandage.
That's an excellent tip for people out there who are using these. What's next?
So this next one is depending on how you want to say it. Olaeus. Like it's got two different names. It's OLAES.
Yeah, I just say the yellow package.
The yellow package, and it was named after a gentleman. So I don't remember the whole story enough to tell it good enough, but the guys at Tagamite Solutions said that it was named after someone. I was like, okay, well that's pretty cool. And they told me the story, but I just don't remember it right offhand. But it's a pretty cool bandage.
This is one of my favorites, actually. It's one of the ones that I like. I love the Israeli, but this one has a couple things that I like even more.
So I like the fact that it has the eye cup on there.
Yeah. The eye cup / pressure cup / anything you need it to be.
Yeah, I mean that's something different. You don't have to worry about the pressure plate forgetting to use it, forgetting to go over top of it. You can put that eye cup, that little looks like a suction cup kind of thing, upside down, and you put it right over top of the wound, and it puts that pinpoint pressure we're talking about.
Mm-hmm.
It does that.
Yeah, and I love that, I do the twist over that one as well to put even more downward pressure into point of injury. It works really, really well. My favorite thing about this one is the wound pad. It's a multi-purpose thing that has a couple different things that you can use. On the Israeli bandage, it's enclosed and it's not hugely thick or anything like that. On the Olaeus, it actually has a surprise inside for you. And what is that?
So you have wound packing gauze that you can pull out. It's non-hemostatic, but still, it's still gauze that we can pull out. And then it has plastic that we could use for an improvised chest seal, or we could use it for those abdominal injuries that we talked about. Maybe we've got some intestines hanging out, something nasty's hanging out. So we want to seal that up. So you can put the plastic down and then wrap the pressure bandage over top of it. So you get a couple surprises. And like I talk to guys all the time who may be building a bug out bag or a get home bag or whatever. I'm like, your bug out bag weighs 75 pounds. You're not bugging out from here to the road. Okay, let's be honest. Like, take the Coleman fuel out, take the Coleman stove out. Like, you're going to be chunking stuff. Like, I don't need this on the side of the road. So, that bandage doesn't weigh but just a few ounces. So why not put that bandage in your bug out bag or your get home bag or whatever, and you have something that can be used for a lot of purposes and doesn't take up a lot of real estate and doesn't weigh a lot.
Yep, absolutely. That's the one that, the smaller my kit gets, I will consider replacing multiple items with this one item.
Exactly. And like I talk about using the eye cup for eye injuries, things like that. Now, when I was first taught about eye injuries, and still some basic first aid classes talk about covering up the injured eye and then also covering up the uninjured eye. And that way, they don't track and things like that. But you kind of have to use like some common sense. I don't know, that's kind of hard to come by sometimes.
Yeah.
But if I'm in a major situation and whatever happened, they may freak the heck out if I cover up both eyes. So, maybe you don't cover up both eyes, but if they allow you to cover both eyes, completely understand. But, if someone say like worst case scenario, they've been involved in an active shooter and they got a piece of glass in their eye, which would be my luck, didn't get shot, just got something in my eyeball, then you start trying to cover up both their eyes, they may freak the heck out. So, but you could absolutely turn that bandage upside down and use the eye cup or the pressure as, an eye injury, face injury bandage.
Yeah. Dang handy. And anything that's multi-purpose. And this one has little hook and loop strips every little bit. So I've heard it referred to as the bandage with brakes.
Yes.
So, if you're putting on the pressure and it slips out of your hand or something like that, it'll just go back to that last strip that's on there, which I think is it's pretty good. Especially
that's the worst thing in the world is be down somewhere on the side of the road and your bandage unrolls. You're like, dadgummit.
I know. It's like, okay, let me start over and do this. What if you're wrapping up and you think you're care under fire or indirect threat, and then a new threat emerges, you have to go deal with that threat. It's not going to release all the pressure if you have to let it go to deal with to overcome whatever threat may arrive.
Yep. And that bandage also at the end of it has, the Velcro hook and loop. So you has two ways of securing at the end. And you can just rub the hook and loop if you want to, and then use the little plastic clips to clip into it. So you have double way of securing it when you get done with it.
Yep. Good stuff. And also going back to the Israeli bandage, that one actually has the newer ones. I think even the older ones have a loop at the end. So if you're self-applying, you can put your arm through the loop and then start wrapping that way.
They do. Yep. I've never seen anybody self-apply an Israeli like that, but they do have it, and that's another advantage they have.
Yeah, I've done it under practice, but yeah,
Yes.
I've never heard about anyone doing it or seen anyone do it.
And they also, going back to Israeli, kind of backstepping just a little bit, they actually have some new bandages coming out too. They just sent me some samples. So hopefully we'll be doing a review on those on the Schematic YouTube channel in the next few weeks as you're listening to this podcast.
Very nice. Blast Bandage.
Yeah, so this one is one I really hadn't heard about until they TACMed Solutions. They sent me their one of their aid bags, and it had the Blast Bandage into it. So I started looking at it. This bandage is huge. Like, it's a little small package, like an Elias.
Mm-hmm.
But when you open it up, it's got this huge pad. It looks almost like a chuck pad. Like, it's massive. And what it is for blast injuries. These blast injuries, those IEDs, they typically will just take off arms or legs, so you end up with a stump that's just massacred, looks like a shark bite. So you can undo this bandage and take the stump of the end of the foot or the leg or whatever is damaged, and you basically just cocoon it. You wrap it up in this huge pad. I don't remember the size right offhand, but it's pretty big.
19 by 19.
How big is it?
19 by 19.
Yes. So she's big, and you can secure it around the stump and get the bleeding, start to help control bleeding and covering up the stump by using this blast bandage. So something that we don't see right now, a lot of blast injuries, IEDs in my pre-hospital, but I'll say it couldn't happen. We just had 2 pipe bombs in my area this week, actually. So yeah, we had 2 pipe bombs. Well, 2 went off at the courthouse, and nobody was out. Went up in the middle of the night, and then found some more possible stuff on top of a building right down the road. So, not saying that it couldn't happen. It's just not. It's pretty rare for us to have those kind of blast injuries, but we see it. Like the Boston City Marathon bombing.
100% agree. They definitely have happened, and will probably at some point happen again.
Yes, absolutely.
I've never seen these either. These are pretty cool and like $8. Oh, and how much are the Elias?
They're about the same price. Still think they're about $12-ish, $13, somewhere around that range.
Okay, got it. What's next?
So I thought since we talk about TACMed Solutions, we should probably talk about North American Rescue, the big gorilla in the room.
There you go.
They have a couple of bandages out too. They have like their first responder dressings, and they're white, and they're usually pretty cheap. And then they have their like military, I won't say grade, but their military issue stuff. And they have some pretty cool bandages out too.
I guess I am not familiar with their bandages at all. So what are some of the features? Are they pretty?
So they've got a couple of like their 6-inch pressure bandages. It looks just like an Israeli, pretty similar to that. The ones I like are their flat bandages. I like they've got a 4-inch flat that works well for like an ankle kit, things like that. Also, they recently, in the last year or two, they released a 4-inch mini, which is less material, it's not as long as the 4-inch flat, but it's still plenty of long enough. And it's a 4-inch wide, but it doesn't take up very much real estate at all, and it's great for an ankle kit, things like that.
Oh wait, I am familiar with those. I actually bought several of them from Medical Gear Outfitters because I was like, this is perfect for all the ankle kits that I've been wearing lately. So
yes, so yeah, like we've got the NAR Mini for $6, and that's with free shipping at medicalgearoutfitters.com. And you can even use the Civilian Medical Podcast coupon code just to kind of throw that out there. You save a little bit of money. So I think those are pretty cool if you're just looking for something. Maybe you're building a kit to take to the office, or you want to put something in your laptop bag or something like that. Like, that's a good option there.
Yeah, absolutely. And they are super small, compact, and I'm pretty much a fan of them.
Yeah, like I said, but they don't have that pressure plate. And when I talked to the guys at North American, I'm like, why didn't you guys put a pressure plate? And they were honest. They said most of the time, like you're talking about, maybe it's a military person, medic, or it's a police officer, they forget to use the pressure plate. Like, they're like, holy crap, this is nasty. And they wrap it up, and they don't use the pressure plate at all. So North American actually did away with the pressure plate. So it basically has an absorbent pad and the stretch bandage, the stretch gauze. So it doesn't have a pressure plate on those.
Interesting.
Which actually makes it lower profile, like, especially if you're talking about the 4-inch mini, the flat, something like that. it makes a low profile because you don't have a big piece of plastic sticking up.
Yeah, and they do have the fold out wound pad. So if you need more area, you've got that as well.
Exactly. But you could always run, you've got compressed gauze. You should have some compressed gauze with you. Maybe you have some 5x9. So you have the ability to stretch some stuff out and then use the compression part as the bandage.
Yeah, totally. All right, that's awesome. Let's see. Moving back over here. Oh, H&H. I'm familiar with those.
Yeah, I wasn't familiar with those for a while. Like we just started carrying those this year. And they're really low profile. Like that was the why I picked them up. They've got a little fancy H bar kind of thing going on, which I was like, yeah, okay, whatever. But they're low profile. Like they are, I can't remember the exact measurements, but especially their thin H bandage, it's the size of your iPhone. Like it's probably no thicker than, well, my iPhone, not your iPhone. But they're
stinking iPhone.
But that's a bandage there again that is super low profile that you could put into your backpack to go to school with, to go to work with, whatever you're looking for. That's not going to take up hardly any real estate at all.
Yeah, and that H bar it's to tie off, right? Like so you can just
it's a little funky. Like you kind of put the pad over the injury. It's got a piece of Velcro, so you make your first loop on, and then you hook it to the Velcro so it stays in place. You run on one side of the H, kind of come through it, make a figure 8, pull back, go around, and come on the other side and go through the H bar. So then when you pull it tight, you're putting downward pressure, pulling from both angles. So it really puts the pressure down on top of the wound.
Yeah, I have messed with these. I've actually never carried one, I don't think. And they're about $10.
Yeah, like I said, they're $10 right now at our shop. So, and then you have the ECD bandage. I had to say, should I say that right? It's a little bit bigger, but it has wings that kind of open up. So if you are thinking about those bigger injuries, the pad actually opens up on that one, and you can get a little broader surface area with that one.
Yeah, and that one's, I don't know, a little bit over $11, something like that, $11-12.
Yep. And like I said, and then the largest one that we carry from H&H is the Big Cinch. It's more of like abdominal. It's probably closer, something that large of an injury. You're probably not going to use it on an arm or leg, but something very large surface area like torso, I think it would work great for.
Yeah, these are pretty cool. What if I don't want all that and I want something that is, just it's like the Gucci version of pressure bandages?
I think that's the one I just did a review on, and man, it is definitely something different than I've used before or seen before, and it's the Air Wrap.
And who does that? What company put that up?
Rev Medic X. They're the same company that does the X-Tat, which is the plunger that has the little pills in it that they expand open. We've seen that all over the internet.
Oh yeah.
The military's approved it. The TCCC committee has approved that for hemostatic agents. And so they have a tourniquet. They have the TX2, TX3 tourniquet. They have the X gauze, which is pretty cool. The gauze itself is cool. And then they have this Air Wrap. And from my understanding, the Air Wrap 4 and 6 inches are standard issue in the M9 bags that are being carried by the military right now.
Interesting.
Yeah, I didn't know that till the other day.
Yeah, that's huge.
So it has a bladder system in it, and the 4-inch has a little pop-off valve. So they kind of think about that more like for the civilian market. So if you pump it up, it get too much air in it, it pops off. So you're hopefully not making a tourniquet with this, because I think very easily this could be made as a tourniquet. When I talked to the representative, I believe he said it would pump up to 300 millimeters of pressure, which is a lot. So you could easily make a tourniquet out of this if you weren't being careful with it. The 6-inch is, of course, 6 inches and wide. It does not have the pressure valve on it, so you kind of have to be careful with it. But there again, I don't think you're going to need to pump it up that much once you start getting pressure on it.
Yeah, that makes a lot of sense. And you said that you can't overpressurize, correct?
Not with the 4-inch. I didn't try it with the 6-inch. If you like, what would happen? But the 4-inch does have a pop-off valve on it that is not going to let you overpressurize it.
Oh, that makes sense. What do these cost?
So the 4-inch is $35 and the 6-inch is $45. So they are expensive. But I think for those nasty injuries that maybe someone who's got a larger leg, that we just can't get compressed down good enough. I think this is where that bandage is going to come into it. Someone like a larger person, and we now have a syringe that basically hooks in. Let's call it like a IV, where we give drugs in.
Mhm.
It pushes in like a blood pressure cuff, and you pump it up, and that's what opens up the air in the bladder and the system. So I think something like that would be, it's a cool option. It is expensive, but I think these medical supplies are like healthcare insurance. We really do want great healthcare insurance. We just really don't want to have to use it. So I think it's one of those things where you can purchase it and then put it up, put it in your car, put it in your IFAC, put it in your backpack kit, and you hope that you never have to use it. But if you pull up on a bad wreck or one of your family members gets hurt, you're going to be glad you had it.
Yeah, absolutely. These are pretty dang cool. And I mean, it just goes to show you can innovate anything, like innovating pressure bandages. We've talked about a bunch of different stuff that has come out at different times. And, clearly the next logical phase here. How heavy duty is the bladder?
It seems like I messed with it a good bit, and I tried to pump it up a lot, like see how much air I could get into it. And it seems very durable. It's covered up to protect it. So I think it shouldn't take that much of a beating, especially when during your evac phase or something like that. You're probably going to have them in a litter or a basket or something like that. So it shouldn't take much of a beating. But it seemed durable to me. And so if it's being used currently by the military, I think they've, have obviously seen some good results out of it.
Yeah, without question. You should stand on it.
Maybe you should stand on it. You weigh more than I do.
Well, okay. It's not made of magic. So, yeah, I mean, we're not trying to like drag guns behind cars and things like that. We're just trying to see if it's reasonable.
Yeah. I mean, I don't think you're going to pump it up and then drag it down the road. Like, I don't think that's reasonable. But yeah, I will pump it up and I will stand on it and I'll post it on Instagram. That's a good idea.
It's going to be awesome. Man, there are so many of these. What's your go-to? Like, what's the one that when someone says, I got $15, what should I use?
Yeah, like for me, like I'm across the gamut, kind of like we talked about. Like on my vest right now, there's an Israeli in there. On my backpack, there's a 6-inch Elias in my backpack right now. I'm looking at my ankle kit that I'm carrying, and it has a 4-inch NAR Mini. So I have the gamut, and I'm using them. So it just kind of depends on where you're wanting to use it, like how you're going to keep it stored. Is what I would recommend.
Yeah, 100%. So small stuff. I've got the Mini from North American Rescue. I do have Israelis in a couple different places, but if I'm talking about just a med kit that I throw in my backpack to go on airplanes and things like that, just for space concerns, I can easily throw an Elias in there, and just take out one roll of gauze because it has it in there already. So
I think if someone was flying or something like that, like I would point them towards the H&H bandage because it's so low profile. Like you can put that in a notebook and nobody's going to see it. So if you're someone who's flying a lot, things like that, and you're worried about carrying your medical supplies, you're worried about TSA taking it, I would look at that H&H bandage for something like that.
That's a good idea. I mean, so when I fly, I have my ankle kit on, and then I also throw the WLS kit available at Medical Gear Outfitters. I throw that in my backpack. So I've got a double up, but that way I've always got my ankle kit, but if I need more, it's there.
Exactly. And you can fly with medical supplies. That's probably another episode, but yeah, you can fly with medical supplies.
Yeah. Oh, I do it. I literally do it all the time. In fact, if it wasn't for my my Mylar blanket, I could probably just walk through security without even taking off my ankle kit.
Does that kick it off?
Something does. My ankle kit every single time, and I've been meaning to like take one thing out at a time to see what it is, but it every single time kicks it off, and I'm like, there's no metal in it. I don't have shears in it. The tourniquet that I have on there has a polymer windlass. I'm not sure exactly what it'd be. The only thing I can think of is that blanket.
That's funny. You should just tell me it's okay. It's just a Glock 19.
And that's how I got arrested.
Yes, put that on video. Let's do that. You would put that on Instagram.
Yeah, that sounds like a terrible idea, but I'll do it.
That's funny.
So you wrote something down kind of as we were talking. Did you want to cover that?
Yeah, like people talk about, we want to back up, or, so I recommend in your kit, obviously having a tourniquet. If you can't afford a second tourniquet, then look at adding a pressure bandage to your kit as a backup. The cat soft T, they're all about $30. So maybe you can't afford to say, look, teacher, I can't afford $60 worth of tourniquets that I may or may not ever need. So maybe you look at using a tourniquet and then putting the pressure bandage as a backup. That way, if you put a tourniquet on someone's leg or arm and it's still bleeding, you can now use the pressure bandage to help you control that bleeding. Maybe you use the gauze out of it to wound pack to go over top. Maybe you just apply it above the injury. I don't know. There's a couple of different options that you could use, but think about that. Now you have a cat tourniquet or soft T or TX2, TX3 plus an Israeli. So you're coming out cheaper, but use it as a backup. I wouldn't recommend, if you think it needs a tourniquet, put a tourniquet on. But now you put a cat on, you put a soft T, like, man, this is still bleeding. Well, then let's look at putting a pressure bandage on top of the wound and trying to use the pressure bandage to help control the bleeding.
I like it. And also multi-use things, you know how I feel about them.
Exactly. So now we have two items that we can run the gamut on what we use them for. They're not taking up a lot of space. They don't weigh a whole lot, and we're able to do that.
Right. Awesome. What else do we have to cover on pressure bandages? I think that was pretty thorough.
I think it was. I think it was pretty thorough. I'm sure there's some bandages left off. So when we post this on the Civilian Medical Facebook page or you see us on Instagram, let us know what we missed, because I'm pretty sure there's one. I got that feeling like we missed one. Like, crap, we should have talked about that one.
I know. And if there is, we'll yak about it maybe in the product of the week next week.
Yeah, we'll hear about it. I'm sure someone will let us know.
Speaking of product of the week, what did you want to talk about today?
So I want to talk about the SOB.
Okay, that's I'm so confused, but that's so other show that I'm on, I thought.
Yes. We're kind of floating that line. Like, we just want to flirt with the idea, but not really be the Howard Stern show.
Yeah.
So AR500 Armor has released their SOB pouch, and I was like, what in the world? But it's their the back pouch, and it's made to go on a battle belt. You can use it on your regular belt too. It has the MOLLE system, so you can MOLLE into your battle belt, or if you're just running, like, say, a Blue Alpha Gear belt, like we both run a lot.
Yep.
Just to throw names out there, but that's a great belt. You can run that, and it goes into the small of your back. It has an outside pouch, and then it has an inner pouch that has some elastic hook to it, so you can put all of your medical supplies in there. And then when you need it, you just pull down, and your IFAK comes out in your hand, so you have it there. Now, you're probably not going to be able to get it back in the pouch by yourself. You're not going to be pretty flexible, but you're probably not so much worried about that if you're having to pull it out. But you could keep your tourniquets in there. You keep pressure bandages. They have them in black. They have them OD green, tan, and multicam. So it will absolutely match your favorite battle belt.
Pretty dang low profile. I'm looking at them now.
Yeah, we did. When we built them out, we did have to put the cat on the outside just because we were putting so much medical supplies inside of there. Like, we put the hyphen chest seals, we put gloves, we put an MPA, we put combat gauze, the pressure bandage. So we've got a full trauma kit. So we did put the cat on the outside. I do wish kind of there was a better way of mounting the cat on the outside, being completely honest. But you can put your tourniquet on the outside, which I'm okay with that, because that way you can get to it fast, and then keep all the rest of the bandages inside nice and clean.
Yeah, this is so are you putting the tourniquet through that loop that comes off the pouch hood?
No, we actually just rubber banded it to, there's some 3 little elastic loops down the bottom of the lid.
Oh, yeah,
and so we just rubber band it to that, because that loop's not big enough for a cat tourniquet, but we could rubber band it that way too. If you just pull it hard enough, the rubber band's going to break and your tourniquet's going to come off there.
Nice. And
then at Medical Gear Outfitters, you can buy the kit empty, or you can buy it filled too. Like, we'll put all the supplies in there for you. So you can do like the small kits is, I think it's like $84.99. It starts with like S-roll gauze, or you can add it with combat gauze or Celox, and you can build it however you want to with a soft T or a cat tourniquet.
That's freaking awesome. I actually have a product that I wanted to talk about a little bit with you. I did not prep you for this at all. I just got in. I was in Missouri like a month ago at the No Other Choice Firearms Train and Learn event, which is like a media type training event. It was training event for like media and content creators and other things like that. And one of the things that they did a demo of was the mobilized rescue systems. Are you familiar?
Is this the one that talks to you like an AED?
This is, yeah. So it's got an app for your phone.
Yes.
All right. So basically, I mean, what it is, it's a med pouch, and I know no one can actually see it, but I have it right here in front of me. It's a med pouch. I don't know if I was going to compare it to VanQuest, it would probably be I don't know, like 4x6, 5x8. I don't know. What do you think? How big is that?
I think that's probably 5x8, something like that.
Yeah, something like that. So pretty well. And then you open it and everything is clearly labeled. So I've got like the tourniquet is A1 and the quick clot is B1 and the chest seal is C1 and the pressure dressing is B2. And it has a face shield, shears, an emergency blanket, an informational card, and gloves. And that's all there. And then I've got a code that came with it for the app, which I have not installed yet. But then this card in Spanish and English. So it's got bleeding and then kind of tells you grab pouch A1, place as high on limb as possible. And then quick clot for bleeding. And then wrap wounds with a pressure dressing, tells you what number they are. And then, so they've got steps 1, 2, 3, and 4. So bleeding, airway, seal, and keep warm, and all the things to do that. And apparently the phone app from the demo that I saw, you install it, you open it up, you hit bleeding, and it literally vocally walks you through kind of what to do. Grab this pouch, put it on here, do this thing, and then ensure bleeding has stopped and continue on with your life. What do you think?
I think it's really cool. I actually saw one of their products. I believe it was one of their products. It was in a Pelican type case. It was a larger case, and they had an iPad inside the case. So when you opened it up, it said, you know, is it medical or trauma? Call 911, obviously. But even like if it had it set up like if it was like someone's having chest pain, it was like, okay, C3 is green. There's a bottle of aspirin there, and it would tell you, like, walk you through stuff like that. So I think it's really cool stuff. You know, kind of, it reminded me like the AED, kind of, you know, that automatic, you know, that's able to walk people. Maybe you're scared, maybe nervous, able to walk them through something and kind of hold their hand while they're doing this. I think it's a really cool idea.
Yeah, I think it's a cool idea too. The thing that I'm unsure about is, I mean, you got a massive bleed going on. You don't know anything about medical. You have this kit, you open the app, and how quick is it? Which we will discover and I will talk about in further shows. But how quick is it? You know, how clear is it? I'm going to actually use it in a couple classes. Kind of at the very beginning, I'm going to take somebody who has no medical experience or whatever, and I'm going to give them a fake injury, and I'm going to hand them this kit and hand them my phone with the app open and kind of just see how that goes. Because I think it is a good idea. And if these kits were kind of just sitting in multiple places, you know, if you have them in your school or your office or something like that, with a tablet or something that you could run the app on, I think that might be pretty useful as long as it works well. And that remains to be seen.
Yeah, I agree. You know, maybe somebody, the one downside I would say maybe I could think of right offhand would be if you've got blood all over your hands, are you really going to want to handle your phone and stuff like that? But there again, the more we can get the right training and the right gear into people's hands, I think that's a huge benefit, huge plus.
Yeah, I was 100% interested in it because I'm a big technology guy. I've been doing it forever, and I'm just super stoked about it. I'm definitely interested in seeing kind of where it goes and what happens next.
That's pretty cool.
Yeah, and I think between 150 and 199, their website wasn't loading very quick. I'm going there now. I think this is the iPack version. And the website's super slow, so look it up. But yeah, this is the iPack version, and it looks like that stands for Individual Public Access Kit. And I guess I don't see a price, but it was between 150 and 199 as it showed up right here as the one that I have with all that stuff in it. So pretty good. And I'll talk about it a lot more. And you know, when you come out here, you can use it as well.
Yeah, I think something like that next to an AED would be awesome. That way, you know, an AED walks you through how to do CPR, things like that. So if you had that kit, it's going to walk you through how to stop the bleed. So I think even if you had someone who maybe had took a stop the bleed course or some other kind of course that had a little bit of an idea, that would help guide them along. So I think it's pretty cool.
Yeah, I do too. And we will definitely talk about it a lot more coming up in further episodes. I think that's going to do it for this week. Anything else?
No, I think that's it. I think we covered pressure bandage. Like I said, that's the redheaded stepchild of Tourniquet. So I think we did him a good job, give him a good cause here. So hopefully this helps some people kind of figure out maybe they're in the market for building a trauma kit or kind of looking at it. So hopefully this video or this podcast, not a video, helps them.
Yeah, I 100% agree. You can find all the stuff we talked about, or most of the stuff we talked about, at Medical Gear Outfitters. Coupon code is Civilian Medical for 10% off. And it helps out Skinny Medic. And I mean, that is his business. That is his job. So if you enjoy the podcast, please go buy some products from there and give him some support. He is the fastest shipping that's around. I think faster than Amazon, actually.
We're trying to do it. So I appreciate the guys and gals who are using the Civilian Medical Podcast. Coupon code is getting used every single day. So I appreciate that.
That's awesome. And the next episode, I believe we're going to talk to another company. You have to wait to find out who it is, but I think it'll be pretty exciting. Maybe even a product that we talked about today. So we will see you next week. Have a great weekend. And Skinny Medic, any final words of wisdom?
No, I hope everyone, thank you guys for listening. Appreciate it.
Do your thing. Do the, you never know when.
I almost did. Like, I almost just have it. Like, you never know when you'll be the first responder. Remember the right gear and the right training.
There you go.
Find us and subscribe at civmedical.com.